A C7-C8 injury affects sensation below the level of lesion. A person with a complete C7-C8 SCI does not have the ability to move their legs or trunk. They should be able to move their shoulders and bend and straighten their elbows and wrists, but have limited use of their digits. Endurance may be affected due to the inability of using their trunk muscles, and there is potential weakness in breathing and coughing. However, it is considered one of the more functional spinal cord injuries, as those with a C7-C8 injury usually have function of the upper extremity. Marissa is a 27-year-old female who suffered a gunshot wound from a drive-by shooting while she was walking into a grocery store. She had no relation to the shooter. The injury was a penetrating injury resulting in a complete SCI at the C7-C8 level. She was admitted to the ED and was later stabilized with no need for fixation of the spine. Her soft tissue was repaired. After 2 weeks on the acute care unit, Marissa was transferred to the inpatient rehab unit. She has received treatment for nearly 6 weeks. Prior to her injury, Marissa recently started working as a pharmacy technician at Walgreens. She has no children and is engaged to be married next year. Marissa enjoys bowling, swimming, and recording her podcast on cooking. She has a border collie named Luna. Lauren, the occupational therapist, will now assist Marissa with bed positioning in supine. First, Lauren supports Marissa's head with a pillow and then places Marissa's arms and feet on top of the pillows. Support under Marissa's heels is important so they do not touch the bed surface. Foam pads or pillows may be placed above and below the client's bottom. This is very helpful when sores are present on the client's rear. Lauren, the OT, assists Marissa with bed positioning in prone. She supports Marissa's head with a pillow. Placing 2 or more pillows under the chest and thighs can help keep pressure off of the hips. It may take a few tries to center the pillows directly under the client. Supporting the feet with pillows or foam pads can keep pressure off of the top of the feet, eliminating risks for sores. It is important to ask the client if they are comfortable after all of the pillows have been placed. It's imperative to also educate clients like Marissa on the importance of bed positioning so they are aware on how to protect their skin, muscles, and joints. Proper positioning can improve range of motion, rest and sleep, and reduce the likelihood of sore development. Lauren explains to Marissa a lower body dressing technique using the reacher. First, Marissa will bunch up the shorts and place it inside the reacher. This is so the shorts won't stay stuck at the bottom of Marissa's foot. Marissa will then lower the reacher and attempt to place her legs inside of the hole of the shorts. After several tries, Marissa is unable to complete lower body dressing independently. Though remaining unsuccessful, Lauren commends Marissa for trying and suggests another approach for lower body dressing. While Marissa had a hunch that the dressing technique using the reacher wouldn't work, it is important for Marissa to try varying strategies to find the one most suitable for her. Marissa shows off her wheelchair mobility skills by propelling herself forward, backwards, and side to side. Marissa is able to park the wheelchair by locking the brakes and demonstrates a push-up to lift herself up from the chair when necessary. She can lift and move her hips from side to side for optimal chair positioning and comfort. Her hand function is still intact as Marissa shows herself raising up her legs for additional positioning opportunities when navigating the wheelchair. Lauren, the OT, will now demonstrate and explain a lower body dressing technique to Marissa. This supine dressing technique is common for those with C7-C8 injuries. It is evident Marissa cannot utilize a reacher, so this supine dressing technique would be most optimal for her and her abilities. Instead of utilizing a reacher or another form of adaptive equipment, Marissa will lay and log roll from side to side to don a pair of shorts. First, Marissa bends up her legs to insert them into the holes of the shorts. Lauren is on standby for supervision and assistance. When the shorts are up to the knees, Marissa goes into supine and begins to log roll from one side to the next to begin lifting the shorts up to her bottom. Using one hand on the bed for strength and support, the other hand is pulling up on her shorts. This will continue for a few cycles until the shorts have reached up to the client's legs. When Marissa has comfortably put on the shorts, she is able to pinch the button through and grasp onto the zipper. Carefully sitting on the edge of the bed, Marissa will now watch Lauren demonstrate how to properly don on her shoes. Utilizing the same technique as before, Marissa bends up her legs and puts on her shoes like usual. She remembers to insert the shoe entirely and to tie on the shoes. Marissa has now successfully completed lower body dressing with modified independence thanks to Lauren, her occupational therapist.